The title of the module that I'm responsible for is the Principles for the Management of Minor Peri-Implant Defects. This topic that I'm responsible for has at the heart of it, and this is a very crucial message that has to come through, it has prosthodontically driven implant dentistry as part of it. Now, what this means is if the implant is prosthodontically driven, in other words, if the implant is to be a support for an ideal restoration one day, then it means it has to be placed in the ideal 3D environment. This is where my fascination with this topic lies, is the fact that as a periodontist, we teach minor management of these defects. In other words, minor procedures. The implant has to be placed ideally. Once it's placed ideally, there will almost always be a small defect around the implant. This is just because once a tooth is lost, we lose bone and we also lose soft tissue. If it is surgically driven, which it should never be, then of course the surgeon will place the implant where the bone is and where the soft tissue is. And this is where implant dentistry needs to come to evidence. In other words, evidence tells us if it's ideally placed, it will be a sustainable result. The learning objectives of this model addresses a few cardinal sort of strong points in implant dentistry. And the very first one is the ideal 3D placement of an implant. If an implant is placed ideally, it means that it must be ideal in 3 different dimensions. And this is, of course, in the mesiodistal, the orofacial, and the coronoapical directions. And this is one of the strongest messages in this module. Once this is done, then it requires a knowledge of the anatomy, of the soft tissue, and of the hard tissue, because now we will see defects around the implants. It will also then deal, of course, with the management of these defects. And the management involves small procedures that can usually be done simultaneous with the implant placement. I think if the learner completes this module, what I would like them to know is the fact that, number one, implants should always be placed ideally in a 3D fashion, prosthodontically driven. Once this is done, in the planning stage, one should be able to identify if there is going to be a defect. Once this defect is then identified, be it soft tissue or hard tissue, the learner should then know that there are different procedures to deal with this. Regardless of if the learner is an experienced or completely inexperienced, they need this knowledge to tell the patients what to expect.